Hi everybody, welcome back to my channel. Maddie here, coming to you from my brother's car. So I just wanted to talk a little bit about, well, I wanted to close off my semester, my nursing semester, talking about my clinical experience. I never did a video over the clinical experience for my obstetrics course. So obstetrics is maternity, everything having to do with mom and baby and the care, complications, before, during, after, and also the normal aspects of a pregnancy, before, during, and after birth. So, surprisingly, I actually thought that I was not going to like this course whatsoever, especially the clinical, just because I've always had kind of like, I don't know, it's not that I don't like pregnant women. I do. I mean, whatever. I like you if you're a good person. But I don't know. I guess I don't have any children. And I haven't been close to anybody that's pregnant or anything like that for me to be like, oh my God, it's so cute. Oh my God, babies, like, yeah, babies are cute and all, but it just, I don't know. I just didn't think that I was going to like it, But surprisingly enough, I think that this has been one of my favorite clinicals out of all the previous clinicals that I've had. And it's actually quite shocking because I might even be considering being a nurse for maternity. And so during this clinical rotation, I was able to go to the different maternity units. So I was able to go to postpartum, which is where the woman goes after they deliver, after giving birth. And you basically take care of just mom. And then I was also able to go to nursery, which is where you take care of a baby. So in some hospitals, this is one single unit, mom and baby. And then in other hospitals, which is for example, like the one I went to, it was one unit for mom and then one unit for baby. So mom had one nurse and then baby had their own nurse. So anyways, I was able to go to the NICU, which is the intensive care unit, neonatal intensive care unit. This is where all your premature babies go, all your large for gestational age babies go, your small for gestational age babies. So basically just any baby that has problems, that needs extra care, goes to this unit. Respiratory issues, very low birth weight, they have jaundice, whatever. And then I was also able to go to labor and delivery unit. So, my last clinical, which was yesterday, I was at the labor and delivery unit, which is basically what I just said. The mom is going into labor and they're delivering. I was able to see a C-section, and I was also able to see a vaginal delivery, which, oh my God. Wow. That's all I have to say. Wow. Like, I have so much respect for women giving birth, regardless, C-section, delivery, whatever. Like, that is intense. It is so intense. And I really, really, really enjoyed watching it. I really enjoyed both. I really enjoyed just, seeing the prepping of the nurse in the surgery room, and the tech, the surgical tech, the surgeon, the anesthetist, like everything. Like it was crazy. Like I saw the surgeon make the incision, and I saw her pull out the baby, and I saw, like, it was something else, and I was like, it was awesome. It was just awesome. Like, I have no words, you know. And then like, it was actually really cool because at one point the doctor was like, oh, come here, whatever, to me and the other student, my other classmate, that we were watching the C-section. And she was like, look, this is the ovary. Like, she was actually like showing us, like, on the patient, like, this is the ovary, this is the uterus, this is the subcutaneous fat, this is the muscle. I was in shock. It was amazing. I was like, wow, this is great. I saw several epidurals being placed. I was able to put a Foley catheter in a patient. It was great. It was just great. And then the vaginal delivery was something else. Like, there was so many people for this vaginal delivery. Like, you know, the nurse got on a stool. She was like applying pressure on the mom, like on the, like, kind of like on the pubic area. Like, it was just amazing. And the doctor was like right there, like sitting in a stool, like literally like just like football, like you know, like a catcher. Baseball, sorry. It was awesome. It was awesome. It was great. And I was there to watch all of this stuff. Like, there was so much gush of like fluids, and there was so much, like, so many emotions. Like, you know, you had like the family, like the mother and the baby, like the first little cry. I wanted to cry. Like, I honestly wanted to cry just because it's magical. Like, it really is. And I know that a lot of people would be like, oh, well, that's freaking gross. Like blood, and oh my god. But it was just wonderful. It really was. But anyways, it was a great experience. Maternity is definitely not for everybody. I'm not sure. Like, I don't really know if I am gonna go into maternity. I just know that I really, truly enjoyed it. Every single time that I was there, I really enjoyed working with these people, with all the patients, with the babies, feeding them, just covering them, soothing the babies and the moms, you know. I think one of the biggest things that I took from this is that care for mom is so important. Even after the baby is delivered, like, we need to emphasize care on mom, because I feel like they're going to they tend to feel kind of like pushed off to the side, you know. Like, when you're pregnant, it's like all the attention is on you, like, oh my god, like, look at your belly, blah blah blah. And then baby is born, and all the attention goes to baby, you know. All the family is like, oh, where's the baby, we want to see the baby. And mom is left over here, like, in pain, hurting, and, you know, it's like, what just happened, you know. So I think that's the biggest thing that I took out of it, to keep providing that care, that love and support for mom, even after baby is born. So that's all I have to say about maternity. I'm really glad that that's over with regardless. I still have one more test to go. Wish me luck, because I really need it. I really, really, really need it. Like, oh my god. But yeah. much love to everybody. Sending kisses to everyone that's going through finals. And if you're not going through finals, well, sending kisses to you regardless. So y'all have a great day. Bye. Thank you for watching. Don't forget to subscribe to my channel. I talk about basically almost anything. I mean, I just talk about things. So yeah. Bye.